To Matt Doran there. Time now for my political panel, Liberal MP Tim Wilson and Labor's Anne Ali. Welcome to both of you and thanks for waiting. Now, Tim, beginning with you, the peak body for Australian GPs says it was given no warning of last night's AstraZeneca announcement by the Prime Minister, Scott Morrison. That's pretty disappointing, isn't it, given the muddy message around this particular vaccine over the last couple of months?
No, not at all, because the decisions that are being made are made by the panel that the government has established to inform the public. And, of course, as soon as those decisions are made, they're communicated to the public.
This wasn't made by the panel. It's not a change of the medical advice. This is a change in the access.
That's true, but it's not as though it's without any discussion with medical professionals, including those that advise the government. I frankly welcome it. I think it's a welcome change, and frankly, I wish it had come along earlier, because I think if there are younger Australians who are happy to take AstraZeneca, then they should be able to and be entitled to do so. I wish personally I had been able to take it earlier. I think it's a good improvement. I think it's one where it does need medical consultation between a patient and a doctor to make sure that they're both aware of any risk, but also to make sure they don't have any other conditions which may create challenges from taking the vaccine. But it's a good outcome.
Dr Anne Ali, the AMA will not endorse the change to allow under-40s access to the AstraZeneca vaccine. The government's been clear that there's no change to the medical advice. It's about access if you want to consult your doctor and make that decision yourself. What do you make of it? Is it a good move? Should it have been made earlier, as Tim Wilson says?
I'm confused. I'm really confused, Patricia. The fact that the AMA was not consulted on this, it appears to me to be a political announcement made by the Prime Minister. The AMA, the President of the AMA themselves have said that we're in a situation where we have overstocked of AstraZeneca, and it appears that expanding the access to AstraZeneca is a response to that. Look, overriding all of this is the failure of this government to provide any kind of certainty around the vaccine rollout to people. People are confused. They don't know what they're eligible for, what they're not eligible for. They don't know, which vaccine they can get now, which vaccine they should wait for. And with the high levels of vaccine hesitancy that we're seeing and the lack of clarity around the messaging, I think that's a real issue here.
Tim Wilson, there are a lot of people who are telling me they feel confused, not just politicians like Dr Anne Ali. No offence, Dr Anne Ali. But
no, it's okay.
Civilians.
Not that kind of doctor, Patricia,
yeah,
that's why.
That's correct. What does that mean, Tim Wilson? How will the government counter that confusion? Because the age eligibility has changed a couple of times. It's obviously confusing many people. They don't know how to make the right call. Now, I know you might say, go to your GP, but there hasn't been a kind of big campaign to explain it and make it clear. Does there need to be more clarity?
Well, different states are creating different rules. In South Australia, for instance, they've said that anybody can get the vaccine in rural and regional areas. In Victoria, they dropped the age limit from 50 to 40 based on the most recent outbreak. So the best thing to do isn't to go and speak to your GP, though that might be a good pathway. It's actually to go and check your state government website on the vaccinations where you can go and book in your vaccinations. But if you want to be able to go and get a vaccine, it's crystal clear now, under the age of 40, if you're prepared to get the AstraZeneca vaccine, you only need to go to your doctor, consult them, and they should be in a position to provide it for you. So the big challenge, and I give praise at least in part to Ed Husick, your former guest, who says that one of the biggest challenges is not confusion, it's hesitancy. And there's a reason for that, because up until relatively recently outside of Victoria, we've been fortunate with a low level of spread and transmission as well as a low level of number of deaths. But it's very clear, sadly, I think, to many Australians now that it's very important to get your vaccine, to get one as soon as you can, and it's ultimately partly your responsibility, not just to yourself, but to the rest of the community.
Dr Anne Ali, you're in a lockdown, of course, in Perth that's been announced late yesterday. And I spoke with Innes Willocks, the head of the Australian Industry Group, before. He was critical of WA going into a lockdown, critical also of Queensland going into a lockdown. He said the New South Wales numbers probably demonstrated they needed to go into a lockdown, but your state and Queensland had been too eager to go into this lockdown too early. Is that right? Is this kind of pulling that lever too early, given there is lockdown fatigue in this country?
Well, lockdown has worked in WA. It's worked in keeping West Australians safe, and there's a lot of praise here for Mark McGowan for the tack that he's taken in not waiting too long, in having circuit breaker lockdowns like we're having at the moment to ensure that this highly virulent strain, the Delta strain of COVID, does not have further community transmission. It is a short lockdown. It is a 4-day lockdown, and all I can say is that it's worked in the past. Western Australia has probably been the most fortunate of most of the states in Australia in terms of the number of lockdowns and the kinds of measures that we've had to take. So I don't agree with that at all. I think that it's the health and safety of West Australians is the primary concern of the West Australian government, and they've done a stellar job in keeping Western Australians safe thus far.
Okay, so Tim Wilson, what do you make of that criticism? Do you think Queensland and WA have locked down too quickly?
I think that every circumstance is different, and I think it requires different responses depending on those circumstances. In New South Wales, they made the argument that short, sharp lockdowns don't work, aren't necessary unless you're in a situation where you have no faith in your contact tracing system, and therefore that was the case that they believed that it wasn't appropriate at the beginning. But that can change based on the circumstances and the outbreak, the degree of responsibility people take, the variants, etc. So I'm not going to get into a debate about comparing them because each circumstance is different, and that's obviously up to responsible state governments. One of the biggest failures in the Victorian state government earlier last year was they didn't take strong action earlier, which led to a nearly 3-month lockdown rather than by delaying decision making.
Okay, so you don't have a comment then on WA and Queensland. You don't agree with Innes Willox?
No, what I'm saying is every circumstance is different, and so I think if you just overlay a consistent theme, everybody doesn't want to be in lockdown. Everybody doesn't want lockdowns. I don't like lockdowns, make no bones about it, but in terms of policy responses, it can be a legitimate, short, sharp measure if it's taken correctly, because the alternative may end up being larger, but that's against the framework in which we want to achieve essentially elimination. I've always said that the objective should be suppression and a management of containment of this virus, and so long as the state governments take the view that elimination is the strategy, which is what they're effectively doing, we're going to face ongoing challenge, which is more the reason why Australians should take the responsibility for themselves and for their community and get vaccinated to make sure we're in the best position not to go down this path again.
Okay, really quick answer on this because I want to get to something else, which is we know that there's been a suggestion from the Victorian Premier that there's a halving of the overseas intake until we get higher vaccination rates. Anne Ali, is it a good idea?
I think, if we're going to talk about immigration at all or bringing in people at all, we need to be talking about federal quarantine facilities. We have the capacity to bring in people, particularly Australians who are stranded overseas, who've been stranded overseas for many months now, if we have proper quarantine facilities.
But I have to interrupt you. I'm talking about the real-world scenario we're in. Yes, some will be built, especially in Victoria, but until then, do you support the halving?
Well, I think until we have quarantine facilities, we can't be talking about the numbers that we'll bring in.
No, I'm not talking about future. These are Australians returning home, a halving of people coming home.
Yeah. I think we owe it to Australians who are overseas to bring them home. We owe it to Australians who are overseas to bring them home and put them into federal quarantine facilities. We've been very slow. The government has been very slow in responding to that.
What do you think, Tim?
I've been consistent that I believe that Australians should have the capacity to be able to return to their country, and one of the reasons we still have many Australians at home is because Victoria shut down its airport last year for many months, which denied Victorians and Australians a pathway to get home.
Aren't you concerned, though, about some of the people leaving and coming back? We've heard cases of people who have left during the pandemic, come back. Shouldn't there be a tightening of that?
I think there should be very tight restrictions at this time, that if people go overseas, that it should be on condition they understand that it may be very difficult for them to get back. But when you had Victoria offline now for last year for many, many months, there are many people whose circumstances changed throughout the year who started the year overseas and were not able to get back. I've always supported Australians being able to return to their country. And I think that this is frankly just another political distraction by the state government rather than actually dealing with the fact that they're operating these facilities. There's no reason why they can't work. There has been failures, and we want to make sure that Australians can return home in a safe way while protecting the rest of the community, and that is the federal and state government's responsibility working together.
The Auditor-General, Tim Wilson, has found that the program to build car parks to deal with congestion busting was not based on merit. Sydney should have got most of the money, but in fact Melbourne got most of the money, and a lot of it went to your electorate. I think, in fact, you were the biggest winner. 6 funded projects, even though they weren't based on merit.
Well, firstly, they are meritorious projects. They were put forward to me by the council at my request, asking them if we can upgrade our car park infrastructure in our community to encourage people to use public transport. Do you have ideas? They came back with ideas,
sure.
and I absolutely fought for them.
But they needed them in Sydney.
I'm immensely proud to fight for the community so that people can get the money and the resources for the infrastructure in our community.
But the merit was in Sydney. That's where they were needed, but you got most of the projects. It looks like pork barrelling.
I am a very, very effective local member in standing up for the community and making sure that we get the resources for our community.
Okay.
And ultimately, the decision is not mine, as you know. It was for the minister and the department to make. But
do you think it was politically motivated? Was it politically motivated so you could win your seat?
Doing so.
Was it politically motivated so you could win your seat?
Politely, no. I'm very proud to fight for the community, and I'm very proud to fight for infrastructure for the community. And anybody who thinks that was the basis in which I won the electorate, which I won at the previous election, and has politely been won continuously by the Liberal Party since Federation, probably doesn't understand the nature of the community and its issues. But I'm absolutely proud to say that I fight very hard for the community inside the government to get infrastructure funding, to make sure that we have the resources we need locally to support residents, because a lot of programs are designed to build things for new communities, whereas existing communities, established communities that have been around a long time, deal with the challenge of densification, and they need support too.
Okay, and Ali, quick response from you.
Patricia, I'm sure that Tim is a very strong advocate.
Clearly he's very good at it.
Very strong, very good. But you know what? Even I know that's pork. Even I know that's pork barrelling. I asked for some car parks to be built in Cowan. Obviously, I didn't get them. The report by the ANAO is damning of this process. It's just another sports rorts, another rort by this government to prop up Liberal-held seats while the rest of Australia suffers. So, I'd like some car parks here. Yep, we've got density here. I'm a strong advocate for my community too. Where are my car parks?
All right, we're about to run out of time. Anna-Lee, how are you getting through lockdown? Have you got kind of a special thing going on?
I'm really, really busy working. So, I haven't even had time to think about it, to be honest, Patricia. I'm just doing my job.
And Tim Wilson, are you like me, living your best life in a state that's not locked down unusually?
It's very weird to watch the rest of the country being in different stages of lockdown where we're used to lockdown in Victoria, but I'm enjoying it and being very... Firstly, I've got both my vaccines, and I'm spending a lot of time encouraging other people to get theirs too, so we don't face this situation again.
Tim Wilson and Labor's Anna-Lee, and that's afternoon.